God morgon Sverige. Good morning.
And Selamat Siang to Indonesia. Selamat Datang.
Excellencies, business leaders, colleagues, ladies and gentlemen, friends. Welcome to this inaugural healthcare forum arranged by Team Sweden Indonesia, the Swedish Embassy and Business Sweden. Today we will hear remarks on and thoughts on continued cooperation in the healthcare sector between Indonesia and Sweden from His Excellency Budi Sadikin, Her Excellency Maja Fjæstad, and His Excellency Pahala and Mansury. And also my dear friend Ambassador Kama will share his thoughts. I want to begin with sharing some views from the Swedish healthcare system. It is a firm Swedish belief that strong social protection and welfare systems are key in achieving inclusive and sustainable growth. These are necessary tools and are not to be perceived as costs and burdens. Indeed, investments in human capital through high quality and equal education and health systems, accompanied by strong social protection, economic empowerment of women, and an effective social dialogue are key elements to foster sustainable, inclusive economic growth. Also, to ensure that the growth reaches all people and can be maintained over time. The main feature of the Swedish healthcare system is that it is publicly funded and delivered to all according to needs, not to the size of your wallet. There are indeed co-payments from patients, but it is only a small share of the total cost. The rest is covered by taxes. This does not mean, however, that we do not have challenges that require us to continuously develop our national healthcare system. And to do so, Swedish emphasis is put on what is called the triple helix concept, a thriving ecosystem of researchers, entrepreneurs, and corporations that jointly contribute to the development of the life science sector. The role of the government is to facilitate and create an environment that encourages innovation and creates a safety net to fall back on as part of the innovation process. The role of the government is also to ensure free flow of products and services that can enhance and contribute to the welfare of all people. To this end, Sweden is a strong supporter of free trade and as well as partnerships between the public and the private sector. We need to find creative ways for business, investments, and innovation to contribute to an inclusive, sustainable development. Friends, the pandemic is still testing our countries, and it has shown at first hand the importance of working together. Global issues require global solutions. Sweden sees a growing need for global governance on health issues and the role of the WHO. The multilateral system and global health cooperation need to be strengthened. We also see the need for strengthened bilateral cooperations. The topics of this healthcare forum, telemedicine, digitalization, academic exchange, serve as motives for further cooperation between our countries in the healthcare sector. I wish you all great success in networking and the forming of new business collaborations. Thank you all for your attention, and thank you for your efforts to strengthen the relations between Indonesia and Sweden.
During the Sweden-Indonesia Sustainability Partnership Week in 2020, the Indonesian Minister of Health joined hands with representatives from the Swedish government to explore a continued collaboration between our two countries for a sustainable development of the healthcare sector. One of the key decisions from those discussions were to organize an annual healthcare forum where industry stakeholders from both countries could get together to identify specific areas of collaboration and make concrete plans for how to move forward. As such, we are so happy to welcome you all to the first annual SISP Healthcare Forum.
As Indonesia and indeed the world continue to fight the ongoing pandemic, preparations are also being made for a post-pandemic healthcare industry that will be better prepared to meet the challenges of the future. Today, industry stakeholders from Sweden and Indonesia will discuss capacity building and the sustainable development of the healthcare sector in Indonesia. Our discussions will review lessons learned and assess what opportunities lie ahead considering the most recent innovations in the healthcare industry.
We will focus on digital healthcare solutions and hospital improvements, both highly prioritized areas by the Indonesian government. Joining us are representatives from Indonesian hospitals, the Ministry of Health, and the Ministry of State-Owned Enterprises. On the Swedish side, we will hear from Getinge, one of Sweden's finest solution providers of medical technologies, and they will share their perspective on how to upgrade hospital capabilities and drive the digital transformation agenda of Indonesia's healthcare sector. Also joining in these discussions are representatives from the Swedish e-health agency and research institutes of Sweden.
Now, it is my great pleasure and honor to introduce to you the Indonesian Minister of Health, His Excellency Pak Budi Gunadi Sadikin. Minister, you have the word.
Her Excellency Ms. Maja Fjæstad, Her Excellency Ms. Marina Berg, His Excellency Mr. Kamapradipta Isnomo, ladies and gentlemen. The COVID-19 would not be our last pandemic. As we recover from this crisis, we must take steps to ensure that we rebuild our capacity to meet future disease outbreaks with effective strategies. The Ministry of Health is fully committed to fulfill its mandate, and despite it is only my 11th month serving as the Health Minister, we have started reforming the health system through the following 6 main pillars. First, primary care transformation. To keep the population healthy, we need a strong primary care and preventive program. Indonesia is going to expand the routine child immunizations to 14 types of vaccines, which include, among others, Japanese encephalitis, human papillomavirus, pneumococcal conjugate vaccine, and rotavirus. We are delighted to welcome partners to produce those vaccines domestically. Second, referral care transformations. By improving access and quality, we aim to strengthen the referral care, especially in the eastern region. We welcome sister hospital between Indonesian and Swedish hospitals. Third, health security system transformations. We aim to strengthen emergency responses through real-time, laboratory-based surveillance and the development of domestic manufacturing capacities of active pharmaceutical ingredients, medicine, vaccines, and medical devices. We look forward to collaborating with research institutions who carry out a lab-based surveillance effort focusing on infectious disease, tropical diseases, whole genome sequencing capacity building, and disease registry, as well as information data storage. Fourth, health financing system transformation. We aim to improve the effectiveness of our universal health insurance scheme. We are fascinated by the maturity and the universality of Swedish universal health coverage, and we hope to learn more about the way it works. Fifth, health human resource transformations. We highly appreciate our human resources and secure scholarship to study overseas. Sweden universities, especially the Karolinska Institute, is among the world's leading university in medical science. We are keen on sending our smartest and brightest students and health professionals to the famous Karolinska Institute. And sixth, health technology transformation. We invite every biotech startup companies and artificial health intelligence to digitize our health system, to create a big one data for health, and to analyze big data for specific health programs. Ladies and gentlemen, it is a great pleasure to welcome you to Indonesia and to learn about your highly reputable companies and institutions. My utmost appreciations to the Embassy of Sweden for organizing 2021 Sweden-Indonesia Healthcare Forum. As much as this forum will open more opportunities to both the Swedish and Indonesian companies, it will as well strengthen ties between the government of Sweden and Indonesia. I wish you all a very productive encounter and a pleasant stay in Indonesia. Thank you.
Thank you, Your Excellency, for joining us today and for sharing your views on the way forward for Indonesia's healthcare development. Our second speaker is our dear friend and partner in the SISP work, the Indonesian ambassador to Sweden, His Excellency Kamapradipta Isnomo. Ambassador Kama, you have the word.
Good morning, everyone from Sweden, and good afternoon, everyone in Jakarta. First of all, His Excellency Mr. Budi Gunadi Sadikin, Minister of Health of the Republic of Indonesia, State Secretary to the Minister of Social Affairs of the Kingdom of Sweden, Her Excellency Ms. Maja Fjæstad, Vice Minister of State-Owned Enterprises of the Republic of Indonesia, His Excellency Mr. Pahala Mansury, my dear friend, Swedish Ambassador to Indonesia, Her Excellency Marina Berg, distinguished participants, ladies and gentlemen. Good morning and also good afternoon in Jakarta. I hope everyone is in a very good state of health. I'm very much delighted to be amongst all of you today and attending the inaugural Sweden-Indonesia Healthcare Forum. This event and future cooperation in the health sector between Indonesia and Sweden is very important given the current global context and could not have come at a more important time. In just recent days, we have learned the emergence of a new COVID-19 variant, Omicron, ravaging certain parts of the world and threatening an outbreak on others. These are indeed challenging times, and for all of us, and also for humanity. Distinguished guest participants, before I continue, I would like to extend my congratulations to Team Sweden in Indonesia for hosting a very successful second SISP event last week. As I pointed out in my opening remarks during the event last week, it is important that we continue to maintain the positive momentum and move forward with establishing constructive and mutually beneficial cooperation to further strengthen our relations. One of the positive outcomes of last year's SISP is the establishment of an important platform that we are launching today, namely the Sweden-Indonesia Healthcare Forum, where stakeholders from both countries can meet with their counterparts to discuss issues of priority in the healthcare sector. The two topics that will be highlighted in the inaugural series are very timely. Number one is digital integration for critical healthcare system. And second, improving hospital operations by using technology as lever. As we have experienced firsthand, the pandemic became a momentum for digital transformation in various sectors of life, and perhaps the most crucial is in healthcare. In Indonesia, the trend of digitization in the realm of the healthcare sector, such as the use of health apps and telemedicine services, continues to grow very rapidly. In fact, a startup telemedicine company coming from Sweden had just recently signed an agreement with an education institution in Indonesia to conduct a user test project to remotely assist with the care of diabetes patients in the province of West Java. As Indonesia aims to digitally integrate its health infrastructure, there will certainly be increasing demand for advanced solutions and technologies that will be counted on to cater Indonesia's goals and ambitions. On this note, I fully support the active involvement of the Swedish agencies, academia, and businesses that will be participating in today's discussions to offer their insights, technologies, and perhaps potential cooperation with their Indonesian stakeholders. Distinguished guest participants, I would like to once again emphasize the importance for both countries to work together in addressing key issues in the health sector, notably in handling the current pandemic, as well as potential healthcare crisis in the future. I truly believe that through open dialogue and exchanging of ideas, that we have a real opportunity to learn and benefit from one another. From Indonesia's perspective, there are two important momentums. Number one, the current efforts to transform its healthcare system, and number two, the G20 chairmanship for 2022. As we have seen, COVID-19 crisis has already shown that underinvestment in Indonesia's healthcare system has restricted the country in its response to the pandemic. However, the greater imperative is to look at the pandemic to be the catalyst to transform Indonesia's healthcare sector through innovation and technology. On this note, I applaud recent efforts by Indonesia's health ministry to address these important challenges and continue to transform our healthcare system. As we also know, Indonesia will also chair the G20 group in 2022, which we have commenced yesterday, and have established the theme, Recover Together, Recover Stronger. Without strong focus and tangible actions to curb the current pandemic, it would be difficult to talk about economic recovery. In this sense, Indonesia looks forward to leading the G20 while placing its utmost attention to healthcare issues. Lastly, I would like to conclude by wishing a successful event, one that will enlighten all of us and bring forth potential cooperation between all the stakeholders involved from Sweden and Indonesia. Terima kasih, tack så mycket.
Thank you so much, dear friend, Ambassador Kama, for your words. And indeed, it is a timely event, a most important time right now to work together within the health sector. Indeed. Our next speaker is the State Secretary to the Swedish Minister for Health and Social Affairs, Her Excellency Ms. Maja Fjæstad. State Secretary Fjæstad, the word is yours.
Your Excellency, thank you. Thank you to the Swedish Embassy, Business Sweden, and the Indonesian Embassy in Sweden for organizing this first Sweden-Indonesia Healthcare Forum. My warmest thanks also to the government officials, healthcare professionals and business representatives that are attending today. It is my pleasure to address you at this inaugural healthcare forum between Sweden and Indonesia. My name is Maja Fjæstad and I am the State Secretary to the Minister of Health and Social Affairs in Sweden. It has been a truly overwhelming time for all of us. The pandemic has hit hard all over the world. Many lives have been lost. Our healthcare workforce has been stretched to the limit, and health systems have been challenged like never before. I think the pandemic has been a reminder that global challenges need global responses. We must act together now to end this pandemic, and we must commit to taking decisive steps to prevent another global health crisis. I would like to touch upon some of the experiences we've had made during this period. The healthcare sector includes several different actors, and I'm glad that this is being reflected in today's program. You have representatives from the government sector, industry, established companies, startups, and academia. One of our common global challenges is the digital transformation of our healthcare systems to optimize the use of technology. It is my firm belief that healthcare must be digital and accessible to all. This is something that we will achieve by enhancing innovation, research collaborations, and co-creations across country and sector borders. For Sweden, e-health, digitalization, and a prospering life science sector is a long-term obligation. The government adopted a life science strategy last year that links e-health and includes several life science stakeholders, including academia, private sector, and government agencies. Telehealth solution and digital services have been used for quite some time in Sweden. One reason being our geography with extensive rural areas, something that I know we have in common with Indonesia. We also have a rather tech-savvy population, I think. There has been an exponential increase in digital healthcare visits during the pandemic, and especially in the spring of 2020, both in sparsely and densely populated areas. Our healthcare sector has been quick to adapt and incorporate digital tools. Since a couple of years, we have almost 100% coverage of e-prescriptions, and our healthcare providers are using electronic health records since at least 10 years. We developed new and safe vaccines against COVID-19 with speed, and the same speed must now be applied to develop new, safe and effective healthcare solutions that can increase the quality of life and well-being that we seek to achieve with the 2030 agenda. Sweden has a strong tradition in cross-sectorial collaboration, and as a small country, it has always been important for us to collaborate with other countries. Our hope is that today's discussion will identify areas that can be explored in collaborations between Sweden and Indonesia. I know that our two countries have worked closely throughout the pandemic, including through private companies that, for example, have donated medical equipment and personal protective equipment to support the efforts of the authorities. We must be able to use the competence and expertise that we have nationally, internationally, and in different parts of society, for example, in the private sector. Only then can our healthcare systems remain sustainable in the years to come. I do wish you a fruitful healthcare forum. Thank you so much.
Thank you, Ms. Fjæstad, for joining us today and for sharing your views on sustainable healthcare development. Our next speaker is from the Indonesian Ministry of State-Owned Enterprises. This is the Deputy for Human Resources, Technology and Information, Mr. Teddy Barata. Mr. Teddy, you have the word.
Thank you for having me. His Excellency Mrs. Maja Fjæstad, State Secretary to Minister for Health and Social Affairs. His Excellency Mrs. Marina Berg, our Ambassador of Sweden to Indonesia and Timor-Leste. His Excellency Mr. Kamapradipta Isnomo, Ambassador of Indonesia to Sweden and Latvia. Thank you very much for having me and also for participating in this meeting. I hope we can come out with some great takeaways as action plans. So we know that currently all over the world still fighting for COVID and trying to recover. This also happened in Indonesia, in our country, and also Sweden. And then that we are part of our war against the pandemic. Indonesia, alhamdulillah, over the past months can be considered successfully and also on track on building up our economy. The game for now, in my humble opinion, is how we can change from being reactive on the circumstances to becoming more proactive on managing the pandemic, also continue the country's growth. The key to be more proactive lies on developing health security, such as allocating more budget on the health development, attracting investment from overseas, including from Sweden, also developing medical staff and facilities. Really sorry for the trouble. And make sure that the digital services and make sure that BT and also energy security. And of course, we are very open for new ideas and breakthrough. And through this meeting, this forum, we would like to welcome any new ideas, any new initiative on how we strengthen our relationship on together Sweden and also Indonesia with projects, with new investment that we can elaborate more. And I wish Indonesia and Sweden can develop health security and become key players in the global health value chains. I wish you all good health, good luck, and thank you very much.
Thank you so much, Teddy Barata. Thank you to all speakers for joining us this morning and for sharing their perspectives both from Sweden and Indonesia. This concludes our plenary session, and when we come back, we will discuss the state of Indonesia's readiness in digitalizing its healthcare system, as well as how Swedish counterparts can support the development. Stay with us, we will be back shortly. Thank you so much.
Ladies and gentlemen, warmly welcome back to this SISP Healthcare Forum. As one of the world's leading countries in innovation, Sweden was early in deciding to adopt a comprehensive digitalization strategy for its healthcare sector. It is undeniable that digital solutions can radically transform the way health and care services are delivered. Technologies like patient flow management, sterile supply management, and operation room management can all help healthcare practitioners respond better to crises like COVID-19. Today, representatives from the Ministry of Health and the Ministry of State-Owned Enterprises will join with Getinge, one of Sweden's finest solution providers of medical technologies, and they will discuss the digital transformation agenda of Indonesia's healthcare sector. Also joining these discussions are representatives from the Swedish e-health agency and research institutes of Sweden. This discussion will be led by Dr. Agnes, who is the co-founder and COO of Prosehat, as well as member of Health Tech ID. Prosehat is a health application that was developed to meet the needs of digitalizing health services in Indonesia. So, Dr. Agnes, you have the word.
Thank you, Mr. Eric Oder. So, good afternoon, everyone. Thank you for joining for the panel session 1, Digital Integrations for Critical Healthcare Systems. So, COVID-19 has overwhelmed the whole healthcare systems globally, not just in Indonesia, but for Indonesia, we even face challenges because the uneven distributions of the healthcare facility and the infrastructure accessibility. The pandemic has intentionally accelerated the use of digital technology to address these complex challenges due to the archipelago nature of the Indonesia. So these sessions aims to understand the state of Indonesia's readiness in integrating digital healthcare system, as well as how Swedish counterparts can rise as a partner. So I will introduce all the panelists for today's sessions. So we have Mr. Setiaji, Chief of Digital Transformation Office from Indonesia Ministry of Healthcare. Hello, Mr. Setiaji.
Hello, Mbak Agnes.
And we also have Mr. Aditya Dhanwantara, Assistant Deputy for Health Industry from Indonesia Ministry of State-Owned Enterprises. Hello, Mr. Aditya. Very warm welcome.
Hello, Mbak Agnes. Nice to meet you.
Yes. And also we have Mr. Raghed Hanna, Senior Director for Digital Health Solutions, Global Commercial Operations from Getinge. Hello, Mr.
Hello, everyone. Good afternoon.
Good afternoon. We also have Ms. Maria Hassel, Senior Advisor and International Coordinator from Swedish e-health agency. Hello, Ms. Maria.
Hello, thank you.
And lastly, but not the least, we have Peter Schell, Mr. Peter Schell, Senior Director for Digital Health Solutions, Global Commercial Operation from RISE. Hello, Mr. Peter.
Thank you, and a pleasure to be here.
Okay, so because we are running on a tight schedule, so we will start the sessions and the panelists. So we are talking about digital healthcare today. So for Mr. Setiaji, as the key stakeholder and policymaker, can you please explain how is Indonesia's state of readiness for digital integrations in healthcare system, and what is the government's plan to develop the digitalization in healthcare sector?
Yeah, thank you, Mbak Agnes. Yeah, talking about readiness level, especially in the healthcare, Ministry of Healthcare, especially. Actually, we are now on the staging what we call digitization. We just only move from manual into the papers or digital, from the paper into the digital. and not yet to the digital transformation, even the digitalizations. Some of some of our department already to digitalization, but mostly not yet digitalization. Because of that, we have some initiative. We established the new team, what we call the DTO, Digital Transformation Office, to accelerate the digital transformations in not only in Ministry of Health, but also in Indonesia. Yeah, we have some programs for that. Maybe I will share what our programs to explain more about what our targets about, especially in the prioritize. Actually, we have the 3 prioritize. Yeah, with 9 digital health transformation programs. The first prioritize is how we can develop an integration of health data. As you know, we have a lot of data, in not only in health facility but also in others regionals and also in the governments, but not yet integrated and not yet have medical record. So we hope with these programs we can integrate it, and not only integrate it, but we will make what we call the single identity health record. We will build personal health records, and then we can use this for analysis, using the AI and also the big data and etc. And then the next programs, the next prioritize is how we can develop an integration, the health application. Yeah, you can imagine in the primary care we have more than 71 applications, and then in the secondary care we have around 51 applications. It's very make headaches for the health workers. Because of that, we need to simplify and also make improve the development for the digital literacy for the health workers itself. And then the last, we will build what we call the health technology ecosystem. Yeah, we have many associations, startup, also some institutions, providers, and etc., vendor IT, etc. So we need to align the goals and together to elaborate to make this happen. Yeah. So yesterday, we have launched sandbox regulatory, and for the first time we launched the piloting for the malaria. Yeah. And then we also will launch next month, what we call the health tech spaces. These spaces and including not only for creative spaces but also the sandbox regulatory and innovation and etc. And also building the talent development. And then the last is the important thing is how we can develop integrated biobanks. As you know, some of university already start for that, but we need to integrate in this because it's very important thing to prepare if any pandemic come in the futures. Yeah, this is what the current situation and what we will plan into the 2024. Thank you.
Okay, thank you for the answers. Very complete and very brief. Next, speaking about healthcare, state-owned enterprises also held a key role. So, Mr. Aditya, what is the plan of Ministry of State-Owned Enterprises, especially its health cluster in the term of digital healthcare?
Okay, thank you, Agnes, for the chance. The Ministry of State-Owned Enterprises recently introduced new 5 priorities as a medium-term 2020 and 2024 roadmap, as shown on the screen. First, we have economic and social value for Indonesia. Second, we have business model innovation. Third, we have technology leadership. D, boosting investment, and the last is talent development. The Ministry of State-Owned state-owned enterprises views that technology as an important point in winning the competition. This can be seen in the C and D points. We believe that the challenge is not anywhere, but within ourselves. We have to integrate the SOE's health ecosystem. This is between the pharmaceutical SOE and the hospital cluster. Through the technology, such institutionalizing digital capabilities, such as data management, advanced management, big data, and artificial intelligence. The SOE health ecosystem has a very wide and deep reach in health services as shown in the screen. So we have the pharmaceutical groups that have about several plants and several companies which has already export to the more than 150 countries. We have 13 plants production. We have 1,200 retail pharmacy and 541 clinics. And also we have 85 diagnostic laboratories, and with the population of 270 million Indonesian. And in the other side, we have hospital groups that have 35 own hospital and 40 operation and membership hospital, and with 120 clinics and one research hospital. From all the hospital, we have about 6,900 beds. And about the SOE healthcare ecosystem, we have segmentation and what we call segmentation, both for the function or the market. So we have the API, commercial drug, and herbal and raw material, herbal finished good, biosimilar, vaccines and blood product, stem cell, radiopharmaca, and medical devices, medical equipment, and consumable, nutritional, diagnostic, cosmetic, and PKRT. So we are integrated. Imagine how big we are, and we are using digital technology to integrate the ecosystem. I think that's all from the our side. Thank you, Agnes.
Okay, thank you for Mr. Setiaji and also Mr. Aditya that you both have shared the plan from both Ministry of Health and also Ministry of State-Owned Enterprises in the term of digital healthcare development. And I would like to ask you both Mr. Setiaji and also Mr. Aditya, what are the challenges that you face in digital healthcare development? Perhaps these questions for Mr. Setiaji first, and then Mr. Aditya can answer next.
Okay, yeah, talking about the target goals and etc. Actually, we have some challenges, yeah, what we face. Yeah, maybe I share again my slide. Yeah, on the right side, we have some challenges. Yeah, first about the data itself, it's very fragmented. So we need to integrate it and also make this qualified, yeah, because our data itself is some of them not qualified. And then the next thing about the regulatory itself. As you know, we still not yet have some standardized, some medical, especially in the medical records. Yeah. Because of that, in this year, we will launch the new regulation, the medical records. And then the next thing is about how its facility, healthcare facility, need to share their data, because we want to build personal health records in the next years. And then the other thing is about the security. Yeah, it's, you know, the law, the act of the privacy. Privacy law is not yet there. Because of that, we need to push this regulation also. And then the other thing is about the talent itself, because many of the health workers not yet awareness about the digitalization, because we want to push telehealth, telemedicine, etc. So we need to improve their capacity about the digital self also. And then the last thing is about the investment itself for the healthcare. We just only got 2% about the total digital health deal for this is in Asia. Because now, for example, for the biotech itself, for the investment, more than $28 billion in the first semesters. Because of that, we need also to improve to make some startup growth. Our dreams to maybe to build like some of one others unicorns, like the last unicorn coming from the fintech. So I think we can also make the new unicorns coming from the healthcare system. I think that's. Thank you.
Okay, please, Mr. Aditya, you may answer the challenges that you face in the digital healthcare development.
Thank you, Agnes. So as what I shown before, our challenges is how to integrate it, the very wide and deep from our group. So there is manufacture and services, trading and distribution, and also services in a hospital. So how can we make integration and in a deep function, so that can serve more better for the patient? I think that's all.
Okay, thank you for Mr. Aditya for answering the challenges that you face. We have heard from Indonesian panelists, so now I would like to move to the Sweden panelists. Sweden has been one of the pioneer countries in integrating digital into its healthcare landscapes. So for Ms. Maria Hassel and for Mr. Peter Schell, perhaps you both can share to us how Sweden achieved this. I would like to invite Ms. Maria Hassel to answer the questions first.
Thank you. Sorry. Yes, I think one thing you have to keep in mind is that Sweden has a decentralized healthcare system. It's the responsibility of our regions to provide us with healthcare, and welfare services like elderly care is provided to us by our local municipalities. And this local level means that the decisions to implement a digital solution or a digital system was made on a local level. There was a local hospital or an individual healthcare center that decided which systems and solutions to try out, which ones would meet their local needs. There was no, initiative from the government of a one system fits nobody kind of things going, but really what systems and solutions would support the process in which they are working. There was even a region that built their own EHR system, which I think is brilliant. This started 25 years ago. So we've had a long time working on it, because digital transformation is an ongoing process. It will never be done. But today that gives us a healthcare profession that is quite digitally mature. They're used to using digital solutions, and they try out new things, and they all document their patient meetings in EHR systems that are digital. So today all of Sweden is digitalized. And if you combine that with the expectations from us as a population, us citizens, we use digital services for everything, really. I just expect to be able to book a dentist appointment online, or I really expect that my GP will share my lab results from my latest visit in a healthcare portal. That also drives the digital transformation. And we have those services, and we also started to have services where you can, if you live in a village in a remote area, a scarcely populated area of Sweden, you don't have to go into town to just talk to your nurse. You can do it on a digital platform, and that gives, that helps move forward the digital transformation. But we know that if we're going to move forward, there are certain things we need to do. So the government has struck an agreement with the local municipalities and the regions of an agreement that is a strategy or a vision. It's called Vision for eHealth 2025, and it's very shortly, it says that we should be the best in the world at using the possibilities digitalization gives us. And in order to do that, we know that we have to address three fundamental challenges, three fundamental conditions that needs to be met. One of them is the use of standards when we build systems. I don't think that 25 years ago, they were talking much about interoperability. I'm not sure, but I don't think so. These days, you have to have interoperability to be able to share information. Another of these conditions is the more consistent use of terms. You have to have a terminology framework, so the words you're using in different systems are the same and interpreted in the same way. And last but not least, it's our laws and regulations that really haven't been keeping up with the possibilities of digitalization. You can share information in a whole nother way these days that you could before. So we have to have laws and regulation that supports the sharing of information between systems and between organizations. But also all the health data that we collect in our systems can be used for other purposes. We collect so much data that could be used for research and innovations, but then we have to have laws that allows us to do that. And the laws and regulations also has to take the patient's integrity in consideration, obviously. So we have integrated digital solutions in the entire landscape. We did it quite well. It took time. It was hard work, and it also involved and so many other actors. The e-health ecosystem has grown. So it involves academia, it involves research, it involves so many more actors than just, I'm not going to say just, but just healthcare providers. And that's a good thing to have in mind. So it doesn't really matter where you are in your digital transformation journey. If you just know that you will never be finished, that's an exciting thing. You will never be finished, you will never be done, because there's always going to be new exciting technology to take in consideration. So depending on, it doesn't matter where we are, we're still going to have a very exciting future. And I look forward to that. And thank you so much for inviting me to this forum.
Okay, thank you, Ms. Maria Hassel. So next for Mr. Pito Shell, perhaps you can share with us how does Sweden achieve the integration of the digital in the healthcare landscape?
Thank you very much, Agnes. Well, from our perspective as a research institute, we are quite active in the innovation value chain in between the public sector and the industry, but also in between academia and real world applications. So what we have seen also during the last 1.5 years, I tend to call it the global digital health pilot of 2020, and what is actually ongoing. What is actually has happened during the last 1.5 years has been immensely challenging, but it has also accelerated innovation and accelerated implementation of digital methodologies, as we have seen all over the world. What we had in Sweden was we had a situation. We are a country that are digitally quite mature. We have a strong, hard infrastructure when it comes to fiber, to connectivity, etc. And we are very tech savvy. We like technology, and we are not afraid of using technology, even though it's in its most intimate setting regarding your own health. So what is actually was a little bit of challenging was around coordination, and this is the background that Maria gave, that we are a country that has the authorities on a national level. We have the regions, which is 21, and then we have 290 municipalities. And all these are delivering care in one way or the other. And this is especially challenging when it comes to how we handle multi-sick or elderly people or frail people. And what was happening actually during the pandemic and what was allowed to dare to try to have the courage to utilize digital methodology. For example, we have had since around 2015 and 2016 digital ways of handling primary care. But what we tried out a lot during the past 1.5 years is how we can put digital care in other contexts, for example, how we can utilize this to achieve higher continuity when it comes to virtual rounds. And also that we have in Sweden a good level of transparency and trust in between the public sector and the industry, because a strong driver of the digital transformation are the tech companies and the tech research organization that can deliver solutions, but that must be need driven. So there is the interface in between the healthcare sector and the public sector, the needs there are, and the technical solutions and possibilities. There must be a really strong interface in between there. And last but not least, I think that after this, if we see an end to this pandemic, I see that we should do a proper debriefing. What worked, what did not work, and how can we scale the successful initiatives? And with that, I want to thank you for being part of this session and open for questions. Thank you.
Okay, thank you, Mr. Petershell, so for sharing your knowledge and your experience to the floor and the audiences. I would like to turn my questions to Mr. Raghed Hanna. Getinge is one of the leading Swedish company in digital healthcare solutions and has had a strong presence in Indonesia market. How do you think Getinge could further support the development of digital healthcare in Indonesia?
Yeah, thank you, Agnes, and you are right. I think we have in Getinge a very good history when it comes to digital health solutions. And I would like to share a little bit and build up on what I heard from all the speakers behind me. Before me, so I see it's a very good base to start this discussion. If we go to the next slide, I heard the number Maria mentioned 25 years ago in Sweden started the digitization journey. And being part of Getinge family, I'm proud to be also since 25 years with this company doing digital solutions. You see on the screen, actually, we heard also the ecosystem in the healthcare environment. We see the operating room is a very important ecosystem where a lot of things happening there, and there's the sterilized supply department also providing the OR with the instrument at the right time for the right surgery. So we have solutions like TDoc, what you see in the lower corner here, to manage the sterilized supply management, moving from paperwork to really digital solutions to have assure also the quality of the disinfection and sterilization of the equipment and have them also on time there. We see also solutions like in the operating room, how often happen that the doctor is not there, that the patient has to delay a little bit because of other things, that the surgery is going longer than expected, that we are missing maybe an instrument here, we need to pick it there, etc. So we have developed also solutions called Torin to increase the utilization in the operating room. Increased utilization means also have a very digital control of all the resources we have around the operating room, that we can react also on time in case of different, let's say, occasions happen during the day. What I would like to speak today about also, because we heard before the intra-probability as well from Maria, how important is that? So in the past, every department, every let's say corner in the hospital think about its own digitalization journey. We have a lot of data. We don't know what to do with the data, etc. So I will introduce from Getinge the patient flow management product, we call it Insight, and I will share a little bit of the success story around that. So the second slide show as well, if we can move to it, what does this solution actually do? We can see on a very simple pathway of the patient, as you can on the screen, coming in the emergency department, being, let's say, coordinated in the emergency department. There's an examination to be done, then there's a decision, okay, there's an urgent surgery need to happen. Then from the surgical, then you are in a new department, new people, new standards, new whatever environment, but it's the same patient still. And then from there, you need to do the surgery, you need to coordinate that, and then you pass that patient to the ICU or recovery room. Again, another department, another people, another environment, but the same patient. So this is, with our solution Insight, we try to focus on what we are focusing on the patient itself, trying to get all the data from the different departments, bring that on a higher level to give the caregivers also the chance to focus more on the patient and have their resources. Avoid, let's say, looking into a lot of data coming from other departments, rather see that on screens, on simplicity, understand exactly what happened before, what is happening now, and what shall we pass as information to the next department. So this is how we can follow the patient flow. And I would like to share a story also from actually a neighbor country to Sweden as well, which is Denmark, which has also implemented this solution in many regions. It has a similar, if we look at the next slide, it has a similar, let's say, structure of the country. We have regions as well, and the regions take care of delivering the services as well to their patients, etc. And we see here two big regions in this country, which are having around 11 hospitals. 20,000 users are using our solution from Getinge Insight to work with their patient on daily basis. And there was a kind of study, you can see also the link, you can look into that, where by using that solution, there are 30% of increase in overall productivity. We heard also about the productivity. How can we increase it? Because digitization, we didn't reach what we want or what we have, let's say now. We want also to increase the productivity, and we want also to increase the efficiency. And also on that one, you see 20% increase the efficiency in that environment. And there is also something very, very important here. By increasing those factors, you are giving actually the caregivers more time to focus on the patient. So consequently, the time those people are spending with the patients is increasing. So we have there then that the digital solution is not just digital to have nice screens and nice data, etc. Rather really to have the patient in mind and give the support to the patient at the end of the day. What we see as well, I heard also from the Ministry of Health, the talents, let's say the things where we have challenges, regulatory integration, etc. So it's really, those are things we as a company getting in deal with on daily basis when we see a partner or a government or a hospital challenged with those kind of things. I will give you, like, Indonesia, don't feel like you are alone with those challenges. Those are actually even in high, let's say, European countries. You believe, I will give an example, Germany, let's say, that is Germany better than Indonesia in digitalization? I would be honest with you, not at all. So you have the challenges we have on daily basis actually with other countries. But what is important here is, of course, to have the willingness from the organizations that we want to improve that. We want to sit together, let's say the different departments, get to see what do we do with the data, how do we integrate that, use HL7 standards to use this data and so on, and have set our KPIs that what we want to do with digitalization here, what are our goals there. And by setting those goals, I'm sure we can support as a Swedish organization here with more than 25 years experience, especially in the digital health solutions, support your journey towards, let's say, really increasing the digital experience and the way of working in your country. And now I'm back to Agnes and others if you have questions to myself.
Okay, thank you for Mr. Raghed, Hanna, for explaining very complete on how Getinge can support the Indonesia in terms of digital development of digital healthcare in Indonesia. But on the other hand, we would like to know from you how would Indonesian stakeholders can support Getinge? In what form, perhaps?
Yes, that's an important question. I think we can't squeeze a digital solution and say, hey, let's digitalize the way of working. We need to now move from paper to electronic sterile processing solution, or we need to follow the patient flow, etc. I think it's very important that those solutions are being supported by the either regions or the government, that they are making the ground to the people to really be creative here and co-architect with the partners like Getinge towards this solution. I think to say to not support that approach, you will end up having a new digital solution, a new data, and you don't know what to do with. Oh, it's again, I need to use another system, etc. So the willingness from the top to say, yes, we want to do that. Those are our targets. Bring the people together and facilitate co-architecting the solutions as a partner for the specific region. So when Indonesia say, yes, we want that, it should be in the DNA of every healthcare facility that, yes, we need to move in that direction, that it's somehow the strategy and the vision is communicated, and then everybody is going in that direction. And we as an organization with our long year experience, we will be more than happy to support in that journey.
Okay, so the key is the commitment and how the top government can distribute all the visions down to all the practitioners in the field. So yes. I get the operator forum that we still have time for short Q&A. We already have some questions, so I would like to invite all the panelists to be ready and stand by for some questions. These questions are being asked by the audience from the comment chat, and it's coming from the YouTube. So we will move to the first questions from the audience. These questions is referred to Ms. Maria herself. Is there any partnership between Indonesia and Swedish government that make it possible for the Indonesians to work or do research in digital health companies or startups in Sweden? Perhaps Ms. Maria can answer it, since it's
that's a very good question, and unfortunately I can't answer that, but I could look into it. We just had the previous speakers were representatives from my ministry, and they would know, but I would love to look into that, because that would be a wonderful opportunity to work together. Yes.
Yes, okay, so it's a very open possibilities to work together in the next future.
Absolutely, it's nothing we have anything against. It could be a good Christmas present.
Okay, thank you, Ms. Maria Hassel. And the next questions is being directed to our three panelists. So it's for Mr. Setiaji, for Mr. Aditya, and also for Mr. Raghed Hanna. The question is, what kind of collaboration needed between Swedish and Indonesian stakeholders to support the development of digital healthcare in Indonesia? Perhaps it can be answered first by Mr. Setiaji and then Mr. Aditya, and the last one but not the least, Mr. Raghed Hanna.
Okay, thank you, Agnes. Yeah, I think this is the good question. Yeah, how to collaboration and also what's sector or what can be collaborated. Yeah, maybe you can refer from my slide. Yeah, we have some challenging for to implement this initiative. First, I think we can collaborate about the digital talents and also the ecosystems, because I know the Sweden itself has succeeded to improve, to make the ecosystem is grow. So I think it's better we can collaborate, maybe make like a startup hub. Yeah, actually when I was in the Jakarta Smart City, I have also initiative from the Swedes to build like a startup hub. Yeah, I think it's, we can also make this collaboration. And then the other thing is about some of technology. Yeah, it's coming from not only how the integrate the facility and also build the standardized, like as you know, we have the health standards for the data exchange, like the fires, I mean the fires, and also some other standards. I think we can learn more from the Swedes, how they can make this standardized for all of the health facility. I think that's it. Thank you.
Okay, perhaps Mr. Aditya can answer us about what kind of collaboration needed between Swedish and Indonesian stakeholders.
Okay, thank you, Agnes. Since we are still developing our digital ecosystem in healthcare, so we are open to any project and all of possibility for the technology that can make our R&D, production, distribution, retail, service, and payment, even on the customer health super apps that can help us to make it possible and implemented. So there is many chance, many ways for the automation, the 4.0 industry. We are looking forward for it. Thank you.
Okay. Last, Mr. Raghed Hanna.
Yeah, I would say how to collaborate is an important question, and I think as we heard, there's a lot to do. This is why I would recommend to assess the specific situation, to pilot as well something together. It's always good to pilot, measure, and make sure, yes, this is what we want to have, and then to roll out. We have had, we didn't grow from today to tomorrow very largely. We started small and spoke to the people, make the pilot, and then assessed and grow afterwards. So I would, as a Swedish company, we would be more than happy to share our experience in making pilots, assessment, and then have a kind of rollout plan as well with the country. Thank you.
Okay, thank you for the answers. We'll be looking forward for any pilot projects between Indonesia and Sweden. Okay, for the next questions, it is directed to Mr. Setiaji and Ms. Maria. It's about teleconsultation. So the question is, what do you think about the rise of teleconsultation in Indonesia? Do you think it is effective for people to get their access to healthcare easier, but less interaction between human touch? Perhaps I would like to invite Ms. Maria first to answer the questions.
I think it's a good thing to do the things that are suitable for digital consultations, to do them digitally. It often has to be complemented with a physical visit. But if it's something the pandemic has shown us that it's not just your doctor's visits that can be done digitally. We've seen that you can meet your physiotherapist digitally, you can meet your speech pathologist digitally, even your dentist. Some consultations can be done digitally. So I think there is a good thing to mix them depending on the need. So if you base your if you base it on what's the need of the patient, you can always see if it's a suitable form of consultation. So one thing does not have to exclude the other. For some visits and some consultation, it's brilliant and just enough. For others, you might need the physical interaction.
Okay, thank you for the answers. Mr. Setiaji, perhaps any comments or any answers regarding the effectiveness of the rise of the teleconsultation, while on the same side, it's becoming easier to access the healthcare, but less human interactions.
Yeah, okay. I think we can learn from pandemics. Yeah, we already together within the 11th platform for the telehealth consultations, like Hello Docs, Youth Doctors, and etc. Yeah. Also, I think Prosehat, and we have learned how this is very effective to give some services, especially for the self-quarantines peoples who has COVID-19 positive. And we also good comment, good appreciations coming from every customer.
Okay, I think there is lost connections with Mr. Setiaji.
Internet connection is low. Yeah.
Okay, you may continue, Mr.
Yeah. Okay. So from these lessons, because we got the good appreciations, coming from the citizens, because it's very useful to give the services, to the self-quarantined peoples. And the next thing we need to continuing this initiative, not only for the pandemics, but also in others initiative, like another telehealth, especially in the rural area. Yeah, because as you know, we have some limitation for the specialists, the doctors, especially. So using this telemedicine, telehealth, we can still give the good services to the rural area. Yeah, thank you.
Okay, thank you for Mr. Setiaji. So the last comment. So there is a comment from the audiences, and I would like to invite Mr. Raghed Hanna to have an opinion for this comment. So Mr. Hendro Nurcahyo comment on the comment box. I agree to reduce the number of applications used by the health workers in the health services because it is very inconvenient for them. It should be summarized and it should be optimized. So please, Mr. Raghed Hanna, do you have any opinion on this comment?
Yes, I mean, let's say it's important to manage the data coming from those applications. I think what we want to do is we want to use this data to optimize a specific workflow. I can say what we are doing today with the operating OR management solutions like Torin. We are actually getting this data and use the machine learning or artificial intelligence to have a smoother and better planning for the operating room. So this is why it is it will be still required to have a specific applications for specific departments and so on. But of course, we should avoid adding the same data to different solutions, so that the solution between each other should get the data by having the proper integration and the proper platform, etc. So it's not bad to have different solutions, but it's very bad to enter the same information in many solutions. And that's what we help by having the integrations and also get the data from its source and use it in a different application, which is enable other outcomes, let's say, to be used by the caregivers.
Okay.
So that's my comment.
Okay, very agreed. No need for the physicians or the healthcare practitioners entry all the data, but it's the same data with the different dashboards.
Different things to be used for other and advanced solution. We heard before, we are still not there with the digitalization. There's always better things to improve and so on. And by getting the data from different applications, we have the chance to improve our processes and workflow in the healthcare environment.
Okay, for the last questions, this is a little bit a comment, and I would like to invite Mr. Aditya from Ministry of State-Owned Enterprises to have an opinion of this comment. So it's a comment from a YouTube audience. This audience said, integration requires multi-institutions collaborations. What would you think that the Telkom, the Ministry of Communication and the Ministry of Health and the other ministries may integrate these multi-institutions collaborations?
Yes, I agree with that opinion, but I don't think it's too many. Actually, it's just within the cooperation and the Ministry of Health for sure, because this is our dream that we have some kind like super apps that the patient is the center of the benefit, just like hospital, clinics, pharmacies, labs that used by the patient will integrate it even for the regulator and the bank and fintech payers and the third-party administration like insurance. So in one super apps that maybe provide like from the telecom or telecommunication, but I think it just need strong recommendation and strong support from the Ministry of Health for sure.
Okay, thank you, Mr. Aditya. And I would like also to ask Mr. Peter Schells from the Sweden panelist that how about the integrations for the multi-institutions collaborations? Perhaps you can share your comment or the experience that you have faced in the previous experience.
I think the first point is
to the Ministry of Health aja. Yang lain-lain kan
disampaikan juga ada Telkom kan, tadi telekomunikasi juga ada di situ.
Ya, tapi kan nggak nothing to do sama kan sama Ministry of Health.
Okay, sorry. No, I think one of the primary prerequisites for achieving, digital transformation is coordination between, authorities and different parts of the public sector to have a consensus around strategy to drive things forward. We have challenges with that in Sweden, but we also have a strong will to overcome this, and that is a good first step. But then we need to maybe reorganize us, maybe challenge some of our processes. But that is the primary thing to do, to have a strong will to work together and also take away protectionism in between different entities, both in the public sector, but also from the industrial side.
Okay, before we close the sessions, there is another last questions coming. It's directed for Mr. Peter Schell. How to encourage the culture of innovation in healthcare or in Indonesia, especially?
Well, I think that an open atmosphere of courage and the willingness to try, and also do pilots and large-scale pilots and not haste things, and also being humble towards the fact that the digital transformation is something that do not happens overnight. We need to try, we need to go back, adjust, and so on and so forth, and do it if we have processes around that and an environment that allow that. That is I think the primary prerequisite for successful innovation.
Okay, thank you, Mr. Peter Schell. So, audience and all panelists, that is the last questions, and we are entering the very last minutes of our first sessions. So I would like to wrap up or summarize this very interesting and very interactive sessions, that digital transformation is actually a continuing process. It's not only just one step and then you stop all the process, but it's an ongoing process, and you keep learning about new things due to the digital transformations. It requires a very strong will and commitment to not only just from the government, but also from the government. It needs to endorse, so all the practitioners in the fields can also move toward the same visions. So we're not alone. Indonesia, we are still, we have partners in doing the digitalizations in healthcare sector. So we still have time, but we need to prepare ourselves to move to the digital, because we know going digital due to the COVID-19 or not the COVID-19, it's inevitable. Okay, so thank you to all the panelists that are already here and already shares to us their knowledges and their experience. Thank you so much for joining our sessions. I would like to hand over these sessions to the MC.
Thank you.
Thank you.
Thank you so much, Dr. Agnes. I would also like to pick up on one of the questions that came in from YouTube, which was connected to our two countries, and whether there is any agreement that is enabling the development of research and innovation and a discussion on this between our two countries. And there is. Actually, we have a memorandum of understanding, an MOU, between Sweden and Indonesia on research and innovation. And this was signed in 2017, which is one of these foundations upon we have built the collaboration between Sweden and Indonesia. Now it's being moved forward through this Sweden-Indonesia Sustainability Partnership, or SISP, as it is named here today. With that, I want to thank you so much, Dr. Agnes, for moderating excellently this panel, and thank you to all panelists for sharing your insights and perspectives here today. We will soon move on to the next session, and there we will look closer at hospitals in Indonesia and how they can be improved through new technologies and innovations. See you soon. Welcome back. Our next topic is something that can have a huge impact for millions of people in Indonesia: hospitals. They are the backbone of health services, and in this session we aim to investigate how technology could support the transformation of Indonesian hospitals. For this panel, we will hear from representatives of the Ministry of Health, the Indonesian Association of Hospitals, PERSI, and Getinge. From Swedish hospitals, we also have Karolinska University Hospital and Sahlgrenska University Hospital joining us. And they will all share their experiences and perspectives on improving healthcare services in Sweden and Indonesia. Our panel will be led by Dr. Grace Celia, who is the CEO of PT Info Sarana Medica. As a part of PERSI, the Indonesian Hospital Association, Info Sarana Medica aims to be the media to promote medical news development, both in promotive and preventive measures. So, Dr. Grace, you have the word.
Thank you very much for the kind introduction, Eric. I'm delighted and honored to moderate such important panel with all great panelists today. Good afternoon, Jakarta time, and good morning, Sweden time. I am Gratia, and I will be moderating the second panel for today. In this panel, we are going to discuss about improving hospital operation by using technology as a lever. As of August 2021, there are more than 3,000 hospitals in Indonesia. This number is low compared to 270 million of Indonesia population. While the development of hospital is being planned in various regions, a hospital transformation in terms of technology is also urgently required to ensure healthcare service delivery. This session aims to investigate how technology could support the transformation within Indonesian hospitals. We have our distinguished panelists together with us today. We have both Indonesia and Sweden side. But before we get into the discussion, I would love to introduce our panelists today. The first panelist is Prof. Abdul Qadir. He is General Director of Health Service, Indonesia Ministry of Health. Selamat sore, Prof. Abdul Qadir.
Hi, Grace. Good afternoon, ladies and gentlemen, and also is our ambassador Indonesia in Sweden, and also is Ambassador Sweden in Indonesia, His Excellencies.
Thank you, Prof. And our second panelist, we have Dr. Lia Gardenia Parta Kusuma. She is Health Technology Assessment and R&D Team, Indonesia Hospital Association or PERSI. Selamat sore, Dr. Lia.
Sore, good afternoon, everybody. My name is Lia Parta Kusuma. I'm from Indonesian Hospital Association. Nice to meet you all. Thank you, Dr. Bruce.
Thank you, Dr. Lia. And we also have Carsten Blecker. He's Chief Commercial Officer of Getinge. Good afternoon, Mr. Carsten Blecker. How are you?
Good afternoon. Greetings to all of you. And it's an honor and pleasure to join you today.
Thank you. And we also have Ms. Anna Sarstrom. She is Head of National and International Affairs, Karolinska University Hospital. Good morning there.
Good morning and good afternoon to you. I'm honored to be with you in this important session. Thank you very much.
Thank you very much, Anna. And the fifth panelist, we have Peter Kelly. He is Medical Doctor, Resident Emergency Department, Sahlgrenska University Hospital. Good morning there, Peter.
Good morning, and really a fantastic pronunciation of Sahlgrenska. It's not the easiest word. And I'm really happy to be here with all of you, and I'm looking forward to an interesting afternoon and morning with you.
Thank you. The discussion will be in talk show, and each of panelists will explain it with or without presentation. To start our discussion session today, the first question will go to Prof. Qadir. As we know, Prof, the pandemic has raised the importance of hospital as the backbone of healthcare system, as well as technology as the main support for the sustainability of hospital. Learning from this pandemic, what is the plan and policy by the government to improve Indonesian health service, particularly in hospital? Please, Prof, the screen is yours.
Okay, thank you, Grace. It's for your good question. And now we are in COVID-19 era. This health issue become our priority right now in Indonesia. This pandemic also make us realize how important the resiliency of health system. So this era becoming the right moment to do health transformation in Indonesia. Ladies and gentlemen, Indonesia until now still has persistent health problem, like for example, high life expectancy at birth, high maternal mortality rate, and also still high infant mortality rate, and also we still have stunting prevalence around 28% in Indonesia. On the other hand, Indonesia also now is the second largest tuberculosis burden globally, and the number of deaths caused by non-communicable disease around 73%, higher than Southeast Asia with an average of 60%. And also, our problem now because population age 50 years and over, smoking highest prevalence among Asian countries. This is our health problem in Indonesia. Specifically, in delivering health services to all the citizens of Indonesia, we also have another challenge. For example, the first one is there are limited access to referral services, especially in areas outside Java Island. The ratio of hospital beds in Indonesia until now around 1.18 for 1,000 population. It is why much lower than the average ratio in the Asian country with 3.3 for 1,000 population. And then also we have limited access to referral services. Another challenge is that the quality of our hospital in Indonesia also still need to be improved. This fact is shown where there are 600,000 to 1 million of the citizens in Indonesia seek treatment abroad and spend around 11.5 billion United dollar for this. There are three destination countries that Indonesia mostly travel to: Malaysia, to China, to Thailand. And why do Indonesia choose these three countries? This is our question now, because they find it is more comfortable for them in terms of the treatment costs and also the quality and services delivery by the hospital. This is our problem in Indonesia, ladies and gentlemen. And then how to overcome this problem? To overcome this problem, the situation, our Ministry of Health developed strategies with known as the transformation of the health system in Indonesia is outlined in 6 pillars of transformation, namely the transformation of the primary services, referral services, health resiliency system, health financing system, health human resources, and health technology. Ladies and gentlemen, to strengthen the referral system, the Ministry of Health implements strategy to improve access and the quality of healthcare. To improve the access, we target to raise the fulfillment bed, excellent services stratification, and target coaching drop network empowerment based on highest cause of death like cardiovascular, stroke, cancer, tuberculosis, mother and child health, and diabetes. And also for the future, maybe it's a chance and a good chance for all of us, especially for Karolinska University Hospital, to be sister hospital with our excellent hospital in Indonesia, like that. Okay, Grace, please continue, Grace.
Okay, thank you, Prof, from the comprehensive explanation, especially on the 6 pillars of transformation in health. Okay, we will move to second panelist. Hello, Ibu Lia. From hospital perspective, what do hospital needs to ensure better hospital care and long-term sustainability?
Yeah, thank you, Dr. Grace, for your question. So if you don't mind, I'd like to explain my answer to several slides. Okay, so your question is about how, or from the hospital perspective, what we hospitals in Indonesia need to ensure better care, better hospital care and long-term sustainability. So the one thing we believe that very important is having the strategy for operation management in the hospital. So we have a lot of theory. We have a lot of several kind of plan in our hospitals. But very important thing is overseeing the day-to-day practices of healthcare facility. So what could be impact to have a big impact for the patient or client, or we call it a patient experience, and also the organizational goals. So if we look in this picture, hospitals today facing a lot of challenges. For example, for financial challenges and hospital productivity, for maintaining patient safety, for regulatory standards, for hospital security, for personal shortage, for technology upgrade, and also for patient satisfaction. So this all we need to make it better and better, and we need to have the strategy for all hospital, and we should give the information to all hospital leaders in Indonesia. Slide, please. If we see that, next slide, please. Yeah, it's the second slide. So if we see the technology, yeah, one of the important thing is about how we use technology as a lever. So we need, one of them is digital health solution. As we know that a lot of doctors now, a lot of the nurses using the digital health for the expertise for the patients. And also in that issues, a lot of medical aspect, we need like integration in health system, integration in digital system, from the laboratory information system for radiology, laboratories, radiology digital system, or for electronic medical record. So there's a lot of digital health solution systems that we could develop in the hospital. Slide. But in the COVID-19 era, there are more issues, more important issues that we could provide in our hospitals, like patient safety culture, smart building. So how we build the good building with clean and safety, and also with the hospital information system, with digitalization, with high quality of services, with a lot of good medical technology, electronic medical record, laboratory information system, radiology, pharmacy, OT, our operation theaters, because now there are a lot of good technique for operation, is like minimal surgery in minimal invasive surgery. So there need a lot of techniques and a lot of supporting for using in routinely. Also in the cath lab, because I work in the National Cardiovascular Hospital in Jakarta, I know that every doctors in our hospital need a lot of need a lot of supporting in hospital management for operational. So how about central sterilization unit? They also need our attention. Also hospital laundry, also about waste in hospital. So in the COVID-19 era, we should know how to prevent the infection in the hospital. We have an important role, not just only for medical issues, but also for the supporting issues. For example, CSSD in the hospital. In our hospital, a lot of devices, complex, delicate, and expensive. And it's very difficult to disinfect completely. So we need a lot of technology with digitalization, because there are a lot of devices there for operation or something. Slide, please. So I think I just want to say to all of you, slide please, next slide, that in the hospital, it's just not only the medical issue we need to focus, but also we need to focus about the operational issues and also non-medical issues. For example, in our hospital, we have a target for 0 infection in cardiac surgery. So it's need a lot of modern technique to make all the devices clean, sterile, and it is we need more technology from all of you. Slides, and in my summary, that it is very important to pay attention to technology as an effort to improve the quality of service in the hospital, not only in the medical aspect, but also in its supporting issues in daily operation. So I think it is my answer for the first question to you, Dr. Grace. Thank you.
Okay. Thank you, Dr. Lia. My note is, even though hospitals face major challenge in operational, but we believe with good supporting from management and support of the technology in daily operation, we can manage the challenge. Thank you, Bulia, for your brief and comprehensive presentation. We will move forward to the third panelist. We have Mr. Karsten Blecker. I have one simple question, but a big answer for you. How could Getinge support the sustainability in Indonesia hospital health service? Mr. Karsten? The screen is yours.
Thank you, Dr. Grace, and good afternoon to the entire audience. I would like to thank for having me and also my colleague Raghed Hanna, who joined the first panel. It's a great honor and pleasure to be with you. I would like to spend a few minutes speaking about the background of Getinge, and then spend a few minutes speaking about what we call value creation partnerships that goes beyond the products and services that we have been offering for many years. If you could move to the first slide, please, that would be helpful. The next one, please. Could you? Okay. Just as a background, Getinge was founded more than almost 120 years ago, and we have more than 10,000 people across the world of direct employees, plus several thousand of other team members and partners with which we are working in different countries. This makes Getinge really like a top 25 medtech company, and we also for many years focusing on Indonesia, in particular with our regional and local management. We have plans in place to actually further increase and reach a next level of focus on the Indonesian market, because we think that this is a really important market with upcoming important changes and opportunities in the healthcare and hospital environment. If we move to the next page for a moment, you can see that, and you will see that afterwards, we also have a division that is not focused on hospitals, and I will speak a little bit about this in a moment. But particular we are a leader in the following therapy and department areas in the hospital environment related to intensive care, without spending too much time here on the different areas within the cardiovascular procedures from a therapy area, and then also from a divisional point of view in operating rooms. And you can see on here the leading positions and product solutions that we have, and in sterile processing. And within this presentation, my brief contribution this morning, I will say a few more words about sterile processing. We're getting in particular holds also a strong position in Indonesia, with a very strong presence in many central sterilization service departments. Let us move to the next page. I spoke about the hospital environment, but Getinge also has a division called Life Sciences that is not serving hospitals, but is serving research, biotech, and pharma industry, contributing to prevent contamination in research and production. And we are very proud to say that besides our strong focus in the hospital and ICU environment, during COVID times with ventilators, with ECMO therapy. Also, our life science division has been critical for COVID vaccine production through our sterile transfer in 2020 and 21. And over this period, we have made investments to double our manufacturing capacity to serving the needs across the world for vaccine production. Let us move to the next page. Here for the last few minutes, I want to give only a sneak preview and a token of what we offer besides our wide range of products, our wide range of services, maintaining the products and equipment that we serve. So I think you all know, and you have seen that from the previous pages, that we providing a wide range of infrastructure, of hospital equipment, of implantables, of disposables, of the according services. But more importantly speaking, roughly speaking, 5 to 6 years ago, we realized that this kind of transactional partnerships that we had with hospitals, where we offer something, we sell something, we service it, is one way of conducting business. It's a very classical way of conducting business that actually the most Western world and hospitals still follow that. But we think that some hospitals are ready for the next step, and that they're really looking for a transformational partnership. And at that moment of time, we created a central practice within Getinge called Value Creation Partnerships that is actually led by Javier Moore. Javier is also an attendee of this panel here today. And he comes with more than 25 years of experience, having led the Accenture healthcare practice. And we have built the central team to be able to support any country in the world working with hospitals and with hospital staff in reviewing and analyzing work streams from to improve clinical and operational efficiency. Here, this is only one case. Coincidentally, we have chosen the case of Karolinska, who is also, I'm happy to see there's a panelist and a colleague and the customer joining the panel today. But we had the opportunity to work with Karolinska on 2 of their central sterilization department sites, focusing really on processes, on people aspects of prioritization, on the way that installed digital solutions have been used, and also of the organization of equipment in the central sterilization department. And this has worked by giving central guidance even during COVID time. So it proves that we not necessarily always have to be locally present, all of us. We have been working with our experienced team in the field in Indonesia, in Sweden. And we have been, of course, this would not have been possible with the full commitment of the Karolinska staff and team that has been supporting this work stream. But by doing that, we have really achieved something that has exceeded our expectation. And if you move to the next slide, you can briefly see the output of it, because we reached an improvement of the number of trays that have been processed in the central sterilization department by team member of almost 50%. We reduced the cost per tray that would be processed by roughly speaking 1/3 or 35%. We managed to improve, Karolinska managed to improve the on-time deliveries from the central sterilization department to the OR by 10%. And I think we all know how important it is that there's a good coordination between the surgical supplies needed to carry out a surgery. We also had an impact, I would say, on staff satisfaction. And Karolinska managed in the central sterilization department to reduce staff turnover by 7 to 8%, and has reached all-time low, I think what I would call turnover of team members in this department, which typically speaking experienced, they have a low single-digit people turnover now, where we would see in many other hospitals a rather 10 to 15, if not higher percentage point of people turnover. And ultimately speaking, related to staff satisfaction, but also related to cost, Karolinska managed to also reduce the overtime, despite improving all of these outcomes from a point of view that I mentioned before, has managed to reduce the overtime by almost 85%, which is absolutely stunning. I need to take the opportunity to congratulate Karolinska for their great collaboration, for the openness to work with an industry partner like Getinge to achieve that. And we are receiving really like numerous other requests from countries who want to go nowadays beyond the transactional partnership of buying from us and being happy with our service, that are saying, okay, what else could we be doing to leverage the existing manpower and people that we have in the hospital, the existing equipment that we have in the hospital, in this particular case in the CSSD from Getinge, and also the existing IT tools, often TDoc, in a more optimal way to have similar achievements. And I think this is something worthwhile to reflect about. And we, of course, we would be more than happy to identify a site in Indonesia where we could be working together in following a similar principle. This is all I wanted to share with you this afternoon, and I thank you again for giving me this opportunity.
Okay, thank you, Mr. Carsten. It's very impressive and informative presentation. Hope many hospitals watch this presentation and do contact Getinge for more information. And we have panelists from Hospital University in Sweden. We have Anna Sastrom and Peter Kelly. Swedish, we have question for you both. Swedish health system perform well in general. From Swedish University hospital perspective, how do you think Sweden managed to achieve this? Since Mr. Carsten mentioned about Karolinska Value Creation Project in his presentation before, Anna, you can go first.
So thank you very much. I think I will start from a broader perspective to answer that question. I think there might be 3 reasons why we are managed quite well in Sweden. First of all, I think it's the long history of the quality registries and screening programs. We have fortunate structure and control that helps us to evaluate and follow up on the outcomes from healthcare. And I think this is very necessary when you want to improve in long terms. The second thing I would like to mention is also the culture where it's allowed to make mistakes, and this way you can rethink health and you can try to improve all the time. And I think that's very also important to have that culture within the hospital. And the third thing I would like to mention is the very strong innovation culture in Sweden that we have actually, and we have been, ranked very highly when it comes to innovation in general in Sweden, and this also implies for university hospitals. And the innovation, of course, is not only within the hospital, but it is in collaboration with the academy and with the industry. And to touch a little bit upon technology, then to be more precise, I would say that we at Karolinska University Hospital, we are very lucky because we have a fantastic infrastructure. And when we moved into our new hospital in 2016, we did not only have a lot of equipment, but we also had the partnership with the industry that was long-term procurement, innovation procurement and the investment that we didn't really buy a product, we bought a functionality, and this has helped us and will help us for the future also to keep upgrading and improving the service from the industry. But these partnerships are also innovation partnerships in that sense that we try to improve processes. And as we just learned from Getinge, we try to improve the outcome together within the hospital. Now, the second thing that we are very lucky to have is actually the close proximity with the other important players within this system. We have the ecosystem of universities and hospitals and industry very close by, which helps the collaboration between us. It's so important to understand the needs of the hospital from I think the industry perspective. They should learn what the unmet needs are, otherwise probably they will produce things that we will not use in the hospital. And at the same time, we need to learn what they can offer, otherwise we will not be able to see and understand what we could have as an opportunity. Now, for the pandemic perspective, I would like to mention the data-driven decisions that has been super important for us. We have been using data to predict each step of the pandemic, and that has helped us to make the adjustments. For ICU departments, we had to increase by 5 times to meet the needs during the pandemic. And we could not have been predicting this without the data. And so this is extremely important for the way we manage our hospitals. And the last thing I would like to mention is the video consultations and the remote healthcare that you actually can provide to your patients. And this has been exploding, of course, during the pandemic again, because we had the technique and we had the knowledge, but we're forced to take the step into using it on a regular basis. And this means that we can actually support both patients and hospitals cross-border, not only within Sweden, but also across Europe and globally. So that was some of my thoughts regarding that question. Thank you very much.
Thank you very much, Anna. And what about you, Peter?
Well, thank you too. Well, in regards to kind of the insights when it comes to, of course, healthcare and innovation, and specifically, I'd say technology, of course, a lot of that in Sweden, just as the rest of the world, is actually not driven by university hospitals, although I'd be very proud to say so. But a lot of it, in fact, comes from other directions. And I'm thinking specifically about consumer wearables in different directions. So a lot about the future and a lot of the direction I'm looking at is not maybe what we can do, but actually what a lot of the tech companies can do. I'm thinking specifically about, for example, when it comes to phones nowadays, anybody who has an iPhone, it's updated. And if you're above 65 years old, of course, you get an alert if you're walking unstable. So that means in Sweden, where we live, about half of the population has somebody who checks how they walk and if they're unstable, etc. And can also alert them if they need kind of help. And that, of course, is something that healthcare could never do. I mean, we could not have half of the Swedish population inside the hospital monitoring them. So I think for me, the way we kind of look in healthcare is that the focus has kind of changed. And a lot of this is moved in a different direction into the kind of partly the private sector, but then I think the university hospitals such as Karolinska and Sahlgrenska, we get kind of a different role over time, where we can work a lot with even more specialized care in some sense, and use technology to kind of direct in that sense. So that's kind of where I see this going.
Okay, thank you, Peter. And we would like to invite Prof. Kadir, Dr. Lia, and Carsten Blecker, because we have one question that you can manage. What kind of collaboration needed between Swedish and Indonesian stakeholders to transform the Indonesia hospital health service? Maybe Prof. Kadir? Okay, I will move to Dr. Lia.
Yeah, thank you for the questions. Dr. Grace, if you ask about what kind of collaboration, I think in hospitals in Indonesia, we have 3 kind of important things. One is services. So we need to collaboration with a lot of medical issues like how to make the collaboration, communication with other colleagues in other hospitals, not only in Indonesia but also in outside Indonesia. So maybe we need like some system for a discussion. Maybe it's like a teleconsultation or telemedicine. So I think it's very important in our era today, for COVID era. And also about infrastructure in the hospital. So I talked about like a central sterilization before in my slides. The issue is not every company nowadays in the world know exactly about that. So I think it's very valuable if we can talk with somebody who expert in that field. Maybe we can do like a research together, or we can do for COVID-19, yeah, especially. Also, we can have like education or training from Indonesia and from Sweden. We can discuss together about how important the quality of medical treatment in our hospitals, or maybe I have an experience in maybe 10 years ago. There are Prof. Jan Inge Hunter. Do you have that name in Karolinska University? So we talk about make the collaboration in research in avian influenza. So it's like 15 years ago, maybe. But I think COVID-19 is also a good idea to collaborate in detection, the immunology response, because we know that immunology in Karolinska is very advanced. So maybe we can learn from Sweden about the immunology, especially for pediatric, maybe also for adult. So it's 3 issues: one for services, second is for research, and number 3 is about education and training. Thank you, Dr. Grace.
Okay, thank you. Prof. Kadir, already with us again. Okay, I have a question. What kind of collaboration do you think that needed between Swedish and Indonesia stakeholders to transform the Indonesia hospital health services?
Yeah, thank you, Dr. Grace. It is a good chance for all of us. It's a wonderful chance for all of us that Swedish and Indonesian hospital also can collaboration, like international cooperation, become like a sister hospital. As you know, maybe in Indonesia also, we still need like support from Swedish University, like Karolinska University Hospital, to improving our human resources, to improving our system, and also to improving for anything. That is why we still need like exchange program between Karolinska University Hospital and our hospital in Indonesia. And also maybe we can make like a joint research between Karolinska Hospital, University Hospital, and one hospital in Indonesia. We still need that. That is why we can also how to collaborate on the field technology, in information, and also in communication infrastructure, bilateral health also, and able to work together to expand the capacity to network the health professional, expert, advocates, and stakeholders in the hospital health services. This is important thing, and then I hope Swedish also can support health system in Indonesia. Thank you.
Thank you, Prof. And before we go to Mr. Blake, we have a question from YouTube. I believe hospitals in Indonesia have used Getinge solution a lot, but may require Getinge assistance in terms of training. How is Getinge interested in possibility of training to increase the capacity of healthcare resource in Indonesia? Maybe Carsten Blecker, you can answer this question and also answer the collaboration needed between Swedish and Indonesia stakeholder.
Yeah, I think it's somehow related, but I think that what I mentioned before, our value creation partnership team is typically pursuing to work with hospitals to improve operational and clinical efficiency. And our approach is really not like a set menu, but it's very customized. And I think that is really differentiating us from any other company that could be trying to offer something similar. Now, in the case of Indonesia, and also in the context of a large part of this panel discussion, I would probably propose that we would be identifying together with the Indonesian healthcare authorities a target hospital or group of hospitals in which we would try to mimic a little bit the experience that I explained that we recently had with Karolinska, working on the work streams and transforming and optimizing the work streams within the CSSD to yield similar efficiency improvements that do not only have a financial positive impact, but they also have an important clinical and staff satisfaction impact if that is deemed appropriate by the authorities, of course. We then from there, once we have established this kind of experience and relationship, we could continue working on any other field that the Value Creation Partnership team, which we call VCP, the VCP team, identifies maybe in other areas. And my colleague Raghed Hanna earlier this afternoon expressed some of the, I think, tools that we are typically speaking also using to anchor the behavior and support that behavior. Overall speaking, if I understood the question correctly on education, this is one of our key focus areas. We typically speaking have been supporting customers on site with clinical applications in the acute care therapy setting, but also due to COVID, we have been moving more and more of our training and educational activities to online. We nowadays, from what we offered in 2019 on site, we have moved more than 70% of our offering, making it available online. And I think that this is a great side effect from the COVID crisis, that we basically have accelerated something that we should have done anyhow, because it opens up the opportunity for many more people in a much more convenient way to follow and to training and to support those professionals. It doesn't mean that we are walking away from the physical face-to-face on-site training, hands-on training, but I think that would be my answer. And yeah, it's truly important it's truly important to continue offering this opportunity.
Okay, thank you, Mr. Kassenblecker. And I would like to invite Anna and Peter. The triple helix approach is very well known in accelerating the innovation in Sweden, including in healthcare sectors. As the representative from University Hospital, do you have any advice to enforce more usage of triple helix approach in Indonesia? Maybe Peter, you can go first. Sorry, Peter, maybe you can unmute your mic.
Sorry. I think there are several resources here. One I think kind of key factor is to kind of physically be in the same location. So I think it's really important to try to get people together, because typically people in the hospital work for themselves, talk to themselves. People in the university, they are for themselves. In the commercial world, they're in their sphere. So I think it's really important to kind of bring a meeting round where you can kind of see each other, where you can talk to each other. So kind of the physical proximity, I think, is kind of one key factor to be successful in this. I think another factor would possibly be utilizing young people. So I think young people more than me. I'm going to consider myself middle-aged here. I was at 40. So I think kind of using young people who naturally have kind of a very interest in kind of crossover between different areas would be another area where you can kind of use that. And I think there are possibilities for Indonesia, but also frankly for Sweden too, to work more with trying to create educations where before we meet each other from the beginning, not when you're 10 years into your career, but actually right from the start, where you use more kind of co-education and research and different, so that there's not research for just for science in the sense that technical science, and then there's medical science, but that you actually work together in these, and also of course work with companies. So I think again, being close to each other and also working with right from the start with young people, I think are two factors in this. Thank you.
Okay, thank you. And what about Anna?
So thank you. Yes, I agree with Peter. I think it's very important. And when I started at Karolinska University Hospital in 2009, my first assignment was actually to help building up the innovation center within the hospital. And this was supposed, the vision was to create the paradise for industry, healthcare, and the academia to work together, to meet and to collaborate. Now, but with that said, I agree with Peter. So you have to actually meet and you have to learn and understand each other. So I think that would be one step. Also, I would like to also comment on the former speaker, because, as a university hospital, we have the assignment of both care, education, and research. And we are very happy to set up collaboration from our side, from Karolinska, but I'm sure Sahlgrenska University Hospital are also a university hospital with the same possibilities here, and I think it would be interesting to for the future talk more about this and see the different opportunities we have. Yeah. So the arena for to meet the different stakeholders, and I think it has to be long term, because you have to get to know each other and to understand each other. Yeah. Thank you.
Okay, thank you, Anna. So for all speakers, thank you very much for being very mindful of the time. We have very insightful remarks in this panel. And from speaker, we get great perspective, and we heard about some important element in improving hospital operation by using technology as a lever. We have big opportunities here in Indonesia, but it's also a challenging work for all of us. This is why we need a collaboration with the countries which already implemented digitalization in healthcare. We can learn from Sweden experience, of course, and we can use some help from private sector, such as Getinge. Collaboration is the key to accelerate the improvement of hospital operation with the help of technology. Thank you very much for all speakers joining us today, and thank you for all the participants who joined in Sweden Jakarta YouTube channel. I will now return the screen over back to MC, Mr. Eric Odar. I give back the screen to you. Thank you all.
Thank you so much, Dr. Grace, for your excellent moderating today. And thank you to all panelists for sharing insights and perspectives. Today, we have had an in-depth look on how to improve the Indonesian healthcare system, and we have identified several areas to collaborate further on during the year to come in these discussions today. Number one, or the first one that was discussed here today, is how to prevent contamination in various areas of the healthcare industries. There was a discussion on operating rooms, but then also in the research field and in laboratories. And here we have heard that there are solutions available from Getinge, and there are also best practices to be learned from. Another area that was discussed was the management of patient flows. And also here, there are systems that can be implemented and solutions that could be very useful for Indonesia. And then a common theme here during the discussions was the digitalization and the fact that data is very fragmented across the country, and that this is something that needs to be addressed. And we also here heard about practical solutions that can be implemented and of great use for the continued development of Indonesia. So we're very much looking forward now to take these issues and others that have also been discussed that I didn't mention now and move them forward. I think we have established a very good dialogue here and set the platform for continued collaboration that can truly make a difference to many of these perspectives. So we're very much looking forward to continuing that work. We want to thank all the government representatives from both countries, the companies that have joined us today, and the topic experts from organizations both in Sweden and Indonesia. We now look forward working on these topics, as was said, over the year to come. And by the end of 2022, we will organize the second SISP Annual Healthcare Forum and report back on the progress, as well as assess how to best continue our collaboration towards an improved, sustainable healthcare system in Indonesia.
Well, we wish you a great continued day, and thank you all, and have a nice evening.
Terima kasih.